DDismuke, both health care providers in the city of Nashville. Ms. Crite is the director of Continuity Home Health Agency in Nashville here, and she is going to give us some information in reference to continuity health care services and to perhaps contrast what you do with the long-term care that one might receive from an organization such as Care America that was established by Mr. Hampton. Could you start us off by giving us that contrast?
Well, we're a visiting nursing service, whereas the patient sometimes prefers to get well in a home environment where money is involved in long-term care, where long hospital stays are no more because you just can't afford it. Visiting nursing service has a very important part to play. We go into the home and teach them things that, like a person has a stroke, we can go in and teach the family how to take care of them. Now, this is once they're out of the hospital, of course. You go in a hospital with an acute problem, and these days you come home to recuperate. People are more comfortable in their home, they learn better, everything is, they're able to reach things better, and in more familiar circumstances they come back from the devastation much quicker. What we do is we'll send a nurse in to teach them how to swallow so that they don't choke, teach the wife or significant other how to feed them. We send in physical therapy to teach them to walk, and a home health aide she teaches them, the family, how to give the bath, or if there is no family, we do the bath. We make the beds and make their environment more pleasant. The patient happens to be a diabetic and is not bedridden, but partially blind or unable to fill the insulin syringes. We teach them how to fill it. If they're unable to fill the insulin syringes, we fill them for them. We come in once a week, fill the syringes, teach them how to inject, how to rotate the sites, what type of insulin they're on so they don't make mistakes, where to store it and how to store it, that kind of thing. Everything that pertains to home health, how to take care of yourself while you're at home, or how someone else can take care of you. We teach, and we do. If there's no one to teach, we teach the patient. If the patient is too sick or unable to learn, we do it for him.
Now, most of your patients are undoubtedly elderly, are they not?
Most of them are elderly, but it's not confined to the elderly. There are patients who have had strokes or are diabetics or had car or motorcycle accidents or some other disorder that are young, and we do take care of them.
Well, is your service private? Is it public?
It's a public service, and it's funded by either Medicare or Medicaid benefits, Social Security benefits, private pay, third-party insurance. Any of these methods. Those patients who have no benefits, we do take care of as many of those as we can as well, because there are people who have no funds.
Ms. DDismuke, as the acting nursing home administrator at MHampton, what is your service population, and what are some of the recent changes in the field of medicine that has affected MHampton, and how have these changes affected MHampton?
Okay, as you know, we've just gotten out of the baby boom, and now we've gone into the era where we have elderly, which we medically call geriatric patients or residents. At MHampton, we've tried to face this issue and the changing things and times by offering an alternative for the patients, and that's the skilled nursing facility that we now have at MHampton Hubbard Hospital on West 5. Usually our patients are always the elderly, but there are times when the young might need our services also, and we try to get them rehabilitative care and get them back to the best possible means of wellness for themselves. Sometimes the patients come from the hospital. You must be in the hospital for 3 days before coming to a skilled nursing facility. And once you've finished at the skilled nursing facility, the patients usually go to an intermediate care facility.
Excuse me, now what is a skilled nursing facility for some of our viewers who might not be familiar with some of these terms, as distinguished from an intermediate facility?
All right. A skilled nursing care facility is where there are rehabilitative services and nurses around the clock. You need more than just that managerial care of someone to be there to give you medication. Usually our patients have IV fluids, they have an NG tube, they have a need of being forced fed because as you know, when you get older, you cut down on the amount of fluids you take in. Also, sometimes the patient's appetite is suppressed. So they have problems with that. Also, the patient might need colostomy care, or they might be completely bedridden and might have decubitus ulcers or bed sores, which need to be taken care of and have a special need for physical therapy daily. And Meharry is unique in that we are hospital-based, so that everything that the patient needs is totally involved within the building, and the patient does not have to go outside. If the patient needs emergency care, the staff is there promptly to help them. The physicians are on the site to help with whatever problems are needed.
Now, what about the financing of persons who will take advantage of that service at Meharry?
The financing is taken care mostly by Medicare. For the first 20 days, Medicare will pay the full cost of being in a skilled nursing care facility. But after the 21st day, that patient must have Medicaid, and then Medicare will make up the difference and become the co-insurance. But a patient can only stay in a skilled facility 100 days unless we receive special permission from the state or federal government to carry them on over.
Ms. Crite, now how does what you do mesh with what Ms. Dismuke is doing in terms of long-term health care?
Well, some of the service she mentioned, like the interostomal therapist and the physical therapist, while the patient is in the facility, they carry it out. But when the patient can no longer stay, or before the patient gets to that stage, we have the same services that we can take into the home. We could take care of the bed sores, the pressure areas, colostomies, ileostomies. We have home health aid service to give baths. We have speech and physical therapy that comes straight to the home.
So you can essentially offer the same services
in the home
that she offers in the hospital. And when we come back, we're going to talk about the cost of that service relative to the two operations.